We're in Kirikira, more specifically in the Kirikira Hospital. I've been part of a 4-week elective here at the Solomon Islands, getting a great opportunity to practice medicine and hone my skills further in my final year of study in this different, exciting environment.
Kirikira itself is a 6,000 people community. They run a hospital here, which has been kind enough to allow bond students to come here and help them. And we're here to basically help learn their medicine, learn some techniques that we might not have back, and also teach them some things if we're lucky enough to do so.
We've been exposed to a number of medical conditions, ranging from minor small things that would be seen at a general practice to very severe diseases and late presentations. But other diseases that are unique to Kirikira, specifically the tropical diseases such as malaria and dengue fever.
I think the thing that definitely jumps out at us the most is the fact that a lot of people tend to present quite late to hospital for things, even just simple skin infections where, somewhere like Australia, you take your child to the GP, the very first day you notice it, and we pretty much already get antibiotics and you'll be along your way to getting treated and getting a lot better. But here, people tend to delay their presentation to hospital for a variety of reasons. And so I think seeing some very progressed illnesses like very bad skin infection.
In terms of our general day events, we get up in the morning, we come to the ward, we see which patients were admitted overnight. We sit down and discuss as a group, myself and the 3 other students, and we go see each patient on the ward every single day, which is our daily event. We come back in the afternoon and do the same, and in between we go to clinics as well.
It's a very big change when you come from a very complex medical system like Australia, where there's the consultants there, then you've got the registrars, then you've got a whole heap of interns, and you've got a whole heap of medical students. So by the time the responsibilities get trickled down, you're doing very common jobs, or very repetitive jobs, if you say. But here it's sort of you are the one deciding on the management of the patient. That's usually a registrar or even the consultant doing that. So you're doing that. So it was slightly scary coming in, but here it's suddenly like, oh, what medication do you want to prescribe this guy with congestive heart failure, who's really fluid overload, and you're like, okay, I really have to make a decision. Okay, don't think anywhere else you could have got that sort of experience. The Bond curriculum is very interesting in the sense that we are exposed to clinical situations very early on, based around simulation. So try to simulate an environment for you which replicates that successfully, in the sense that you can be exposed to the pressures, the stresses, your jobs that you need to do. So Bond did that quite early on. So you feel comfortable, you don't feel out of your depth when you come into something like this.
I think this experience has changed my view of medicine. It's reminded me again of just how we, approach people. Remembering that no matter where we're practicing medicine, it's still the same people we're working with. They still have the same needs and the wants, wanting to know what's happening to them, and just the fact that we can still reassure them, even in a resource-poor setting, by just sitting down and talking to them, explaining to them what has happened, what we have done for them, what the outlook for them would be from here on out.
These 4 weeks at the Solomon Islands have given me a sense of responsibility that, as a medical student, that we've never really had before. And it's really given me a unique perspective of what it's like being a doctor and being able to impact on people's lives in such a acute and powerful way. And I think that has just reinvigorated my passion for medicine as a whole, and knowing that I can make a huge difference in a person's life.